When you think of coffee, you think of a quick jolt of energy, maybe, right? Well, one mother has put a twist on this. A mom, she is giving coffee to her 7-year-old son, Rowan, after reading claims on the internet that coffee may aid a child's ability to focus more. Let me add, her son has not been diagnosed by a medical doctor. She just feels that he could suffer from ADHD. Dr. David Rosenberg, professor at psychiatry at Wayne University, joins us now to talk about this controversial subject. Dr. Rosenberg, thanks for joining us. Let's talk about this mom in this particular case, seen on Good Morning America with her son Rowan, as you were. Do you find that more and more parents are self-diagnosing their kids without bringing them to a doctor?
This is something that we at Wayne State and the Children's Hospital of Michigan have been concerned with for quite some time. We know that these are real diagnoses and that there are real problems. Many children and families are suffering. Our concern is that the best predictor of a good response to treatment is having an accurate diagnosis. And self-diagnosis can be complicated and sometimes even disastrous.
And Dr. Rosenberg, we do not want to demonize Rowan's mom. She says that this works for her. She uses coffee, and she says he can now focus. If I tell him to do something, he does it. And she said, I'd rather give him a cup of coffee than something like Ritalin. But what do you think about her giving her child coffee? Could it have long-term effects, even though it helps him focus?
Well, I can't comment on his case in particular. I've never met him, and I think the only thing that as a parent and a physician is I commend any mother doing what she thinks is right for her child. That's all that we want to do. What I can do is talk with you in generalities, and what I can say is that caffeine, like many other things, is a drug.
Right.
And when it's taken in moderation, 1 to 2 cups of coffee per day, that's fine. But I have significant concerns. What are the effects of caffeine on a developing nervous system?
That's
we know
point.
that.
Let me play a sound from Rowan's mother, and she explains why she gives coffee to her son. Let's listen to that, then we'll come back out to you.
He doesn't overreact if we ask him to pick up Legos, rather than screaming and throwing a tantrum, throwing himself on the floor. And if we ask him to sit down and do his homework, he can actually do it.
So if there is a mom at home, Dr. Rosenberg, who's thinking, my child has ADHD, can I take him or her off Ritalin and turn to coffee? Or do you say, see your doctor?
No matter what drug, whether it's caffeine, whether it's Ritalin, any other medicine, you always want to do this in concert with a physician. And what's more is the best predictor of a good response to any diagnosis, to any type of symptoms that your child is suffering from, is making sure you have an accurate diagnosis. And without it, all too often, I find that there are disastrous consequences. So I emphasize, having written 2 textbooks on pediatric psychopharmacology, but having seen the dangers when medicine is misprescribed, and also how wonderful it is when we get it right. That is, we have the accurate diagnosis and use the right medicine. And the good news for children suffering from ADHD is that the medicines out there, when they're prescribed correctly, are among the safest in all of medicine.
So, Dr. Rosenberg, just a couple seconds left. To parents out there, the Google is shouldn't be used as your physician, correct?
Yes, there are dangers to using caffeine in any drug. Anxiety, agitation, you can even get an ulcer from this. It's something you want to do in concert with your physician. Might it work for some cases of ADHD? Yes. Is it as likely to be as effective as the current available medication and non-medication treatments? I don't think so.
So self-diagnosis, not a good thing. Dr. David Rosenberg, thank you.
My pleasure.
Cross Country, sponsored by Buick.